The end of the AIDS epidemic is a real possibility. We already have the tools, but in order to succeed, we will have to use these tools more strategically. If treatment coverage remains constant, the number of HIV infections will continue to increase over time. In contrast, expanded coverage could prevent 28 million HIV infections and 21 million deaths associated with AIDS. To expand coverage, new treatment targets were proposed by UNAIDS. If 90% of people with HIV know their status, if 90% of people with HIV who know their status are on treatment, and if 90% of people on treatment are virally suppressed, transmission of the HIV virus to the next generation can be blocked, thereby ending the AIDS epidemic. Increasing access to point-of-care diagnostics can help achieve the first 90 and the third 90 targets. Increasing access to point-of-care early infant diagnosis can reduce the turnaround time for results to be returned to the patient and enable timely treatment initiation. Similarly, viral load testing can enable the early detection of treatment failure. If treatment failure is caused by lack of adherence to treatment, it can be corrected by adherence counseling. Treatment failure caused by HIV drug resistance would enable timely switching to second-line treatment. A partnership between CHAI, ASLM, UNICEF, EGPAF, and UNITAID was established to accelerate access to and promote integration of new HIV point-of-care testing into national diagnostic systems. The project is currently being implemented in 15 sub-Saharan countries, and many lessons have already been learned. The lessons learned from implementation of this project, combined with the knowledge and experience of various organizations working in laboratory diagnostics, led to the development of a guidance document to assist countries in the introduction of HIV point-of-care diagnostics into national health systems. It also led to the development of a companion point-of-care toolkit. This package targets key areas for the introduction and scale-up of point-of-care testing into national programs. It focuses on point-of-care HIV testing, particularly early infant diagnosis, CD4 staging and monitoring, and viral load monitoring. And it can be used by program managers, donors, policymakers, and implementing partners, as well as personnel involved in procurement and logistics, training, and quality assurance. The guidance document is divided in two parts. Part 1 provides background information on HIV point-of-care testing and its potential contribution to meeting the 90-90-90 targets. Part 2 outlines the steps and key activities for introducing HIV point-of-care diagnostic testing into national programs. Part 2 is divided into 7 major modules. One cross-cutting module, named Monitoring, Evaluating, and Improving Quality, and 6 distinct modules, Policy and Framework Development, Strategy and Planning, Regulations, Quality Assurance and Data Management, Procurement and Supply Chain Management, and Implementation. Each module consists of multiple sub-areas or components. For example, under Procurement and Supply Chain Management, there are 3 sub-areas: Procurement Methods, Forecasting and Supply Planning, and Warehousing and Inventory Management. These 7 modules represent the key areas that should be considered when introducing HIV point-of-care technologies in any country context. The order in which activities are presented here is not meant to be prescriptive, and not all activities necessarily need to be implemented in all countries. These activities are suggestive, and countries should adapt and modify them according to their needs and context. Linked to the guidance document is the point-of-care toolkit. The POC toolkit is a digital repository of tools, resources, and guidance documents to support the introduction and scale-up of HIV point-of-care technologies. It is available at the Children and AIDS website, which is hosted by UNICEF. At this stage, the point-of-care toolkit contains 4 modules. product and site selection, which contains tools to help countries select the most appropriate point-of-care technologies and the facilities which will benefit the most from point-of-care testing. Forecasting and supply planning, which includes tools to help national programs forecast diagnostic commodities and supply planning of point-of-care technologies. Regulations. It includes information about regulatory processes and frameworks for medical devices, product evaluations, national registration of manufacturers and products, and post-market surveillance. And quality assurance, which includes topics such as quality assurance of point-of-care testing, site certification and monitoring, and budgeting for quality assurance. The point-of-care toolkit is available in English, and the associated guidance document is available both in English and French at the Children in AIDS website, whose address is shown here.